Hello,
Hi, good
good
evening,
evening, everyone.
Good evening,
I
everyone.
welcome
Hi,
you all.
Rujita. How are you? So, we are today here to celebrate the grand finale of International Webinar Contest India chapter. So, we have Dr. Rujita with us, and also we have our fantastic participants. And shortly, Rujita will give us a tour through this program, and we will have a brainstorming session over here where we have all the participants who has been shortlisted, and they have worked really hard, and today it will be the question answer session which we have kept open. So if you are here and if you are listening, if you have any questions, you can also put your questions in the live chat or in the comments below this video. Okay, so good luck to all the participants, and Rujita, I request you to take this program forward. Thank you.
Thank you, ma'am. Good evening, everyone. I welcome you all on behalf of Indian Academy for Clinical and Dental Genetics to this grand finale of International Webinar Competition, which has been arranged, which is the India chapter. So, the International Webinar Competition is a free program that is organized by Indian Academy for Clinical and Dental Genetics in this pandemic time to encourage the budding and upcoming students and also the early career researchers. So, to move forward with the program of competition, we have the chief guest and the jury member for today's competition, that is Dr. Priya Dio, ma'am. Ma'am is the assistant professor at Bharati Vidyapeeth deemed to be University, Pune, Maharashtra. We welcome you, ma'am. And we also have Dr. Gargi Roy Goswami, ma'am. Ma'am is the founder and director of Indian Academy for Clinical and Dental Genetics. Ma'am is also one of the jury member for today's competition. So we welcome all the participants as well.
Okay, so we have our participants here, and I think there are some technical problems because of which Dr. Priya um, is not able to connect at this point of time. But as soon as she comes in, I'll 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 just bring her on screen. So let's just start with the session. And first of all, Rujita, I would just like you to just introduce our first participant who would be here, and I think we can start with the question answer session. And I think before that, we can do one thing which I'm missing out. That is, I'll show you a very fantastic video where you will know about our participants and how enthusiastic they are and how fascinating topics they have come up with, where they have already shared their experiences and webinars with us. And after a quite rounds of evaluations, today we have come to celebrate the grand finale. Okay, so allow me 2 minutes just to show you this fantastic video to know who our nominated participants are. Okay.
Hi, I'm Dr. Mohan. I'm an neuropathologist. I am currently pursuing my PhD degree from Amrita Institute of Medical Sciences, Kochi. My area of research is salivary proteomics in early detection of oral cancer. I hope my talk or presentation would spark some curiosity in some of you to pursue research as your career. So that's what I intend to do with my webinar. Finally, I thank Dr. Gagi ma'am and her entire team at IACDG for coming up with such interesting and fresh ideas during these COVID times. Thank you all.
Hi, this is Dr. Sudarshan Gupta. I'm from Kolkata. I'm currently pursuing my master's in oral and maxillofacial pathology in Sri Balaji Dental College Hospital, Chennai. I'm very much excited to join the upcoming international webinar conducted by Indian Academy for Clinical and Dental Genetics, where I will be unveiling the psychological insights of chronic conditions of the cancer patients and related pathologies in this pandemic situation. Thank you.
Good day, everyone. I'm Dr. Prajna Shetty from Bangalore, India. I'm a prosthodontist and implantologist by profession. I'm working as a reader at Rajarajeswari Dental College and Hospital. And I'm thrilled and excited to take part in the upcoming webinar held by Indian Academy of Clinical and Dental Genetics. And I would like to speak about the new technique which I have introduced, that is the hidden overdenture bar in fixed implant retained hybrid prosthesis. Thank you so much.
Very good evening to all. Dr. Anvisha, a whole managerial radiologist from Mangalore, the gateway of Karnataka, are excited and enthusiastic to participate in the international webinar competition, which is hosted by the Indian Academy for the Clinical and Dental Genetics. Thank you and
very good evening to all. This is Dr. Gaurav from Mangalore, the home of IST. I'm a PG student in the Department of Oral Medicine and Radiology. Today I am very enthusiastic to participate in the international webinar competition hosted by Indian Academy for Clinical and Dental Genetics. Thank you.
Hello, I am Dr. Sudarshan from Muzaffarpur, Bihar. I'm a dentist and have my own setup since last 4 years. I'm very excited to participate in international webinar competition hosted by Indian Academy for Clinical and Dental Genetics.
This is Dr. Panti. I'm a dentist and I'm currently pursuing my MSc in forensic odontology at National Forensic Sciences University, Gandhinagar, India. And I'm really excited to participate in the international webinar competition, which is being organized by the Indian Academy for Clinical and Dental Genetics. Stay tuned for more.
Okay, so we are back, and so we have Dr. Priya with us. So thank you, Dr. Priya, for joining in. And I know there is some technical glitches, not a problem. So we can start with the question answer session. Dr. Rujuta, can you just call up our first candidate?
Yes, ma'am. So I welcome all the participants and best of luck to everyone for this international webinar competition. So the first participant for today is Dr. Surabhi Sinha. I would like to welcome her to interact with our jury members for the competition session. And the topic for which she'll be presenting is mucormycosis, a deathly blow in post-COVID scenario. Ma'am, you're on mute.
Okay. Hi, can you hear me now?
Hi, ma'am. Good evening.
Good evening. So, Dr. Surbi, your session was on mucormycosis, right?
Mucormycosis. Yes, ma'am.
A deathly blow in post-COVID scenario. So,
Yes, ma'am.
okay, we have Dr. Priya because there are some things which goes on with technology, always give you punches. Okay, so Dr. Surbi will go very fast, and I just wanted to ask you one question. That first of all, I understand that you are a practicing dentist, right?
Yes, ma'am. Yes.
And that you have presented on this very important and very pertinent topic, that is mucormycosis, deathly blow in post-COVID scenario. My first question is that why did you select this topic?
Because, ma'am, everyone is just facing this challenge in this time, in this pandemic time. This mucormycosis, it itself emerges as an epidemic in this hard time. So I thought we should know more about this, and we should just know some more things about it. We should know how we can prevent it,
and how we can just stop it from becoming just
All right.
an epidemic, you know.
Yeah. So, do you, as a practitioner, have you seen such cases in your practice?
No, ma'am.
Not yet.
Uh, I have not just came across any cases
All right.
of mucormycosis till the time.
Okay. So, Dr. Priya, if you have any question regarding this, Dr. Shurbi has presented a topic on mucormycosis, a deathly blow in post-COVID. You can kindly unmute yourself and you can just ask your question. Dr. Priya, if you are able to hear me.
Yes. Hello, ma'am.
Hi.
Hello, Dr. Surbi.
Hello, ma'am. Hello.
It was a very good topic that you have selected, which is a currently a lot of cases been reported in the COVID-19 pandemic. So no questions. Just as ma'am said, just I would also like to know what any case or any specific literature you have come across regarding mucormycosis in this current times in COVID-19 patients specifically.
Ma'am, currently I've just gone through the through some news, and whatever it was going through in the country, the entire country was facing, and especially it was the first case was reported in Bihar only, and it was in Patna, and that gave me the gave me the
Motivation.
so that I can, yeah.
So, is there any statistics that you can provide, like how more, like, can you give us some statistics where you can tell us something about how prevalent how prevalent in this pandemic is mucormycosis in particularly in your place, or as you said, it started in Patna, so maybe like I take Bihar and Jharkhand. Can you give us any statistics on this?
Now, ma'am, sorry, ma'am, I am not.
Okay,
I
no
don't.
problem. I think that's a very good topic that you came up, and I think your presentation was fantastic. Thank you, Dr. Surbi, for all
Thank you,
your
ma'am.
efforts and for participating in this webinar. Thank you.
Thank you.
Bye bye.
Thank you. Bye.
Okay, I think Dr. Rujuta, can you just
So
bring?
thank you, Doctor. Yes, yes, ma'am. Thank you, Dr. Surbi. So the next participant for today's evening is Dr. Mridula Mohan. The topic of her presentation is Innovations in Salivary Biomarker-Based Diagnosis in Oral Cancer. We welcome you.
Hi, Dr. Mridula. Can you unmute yourself? Hi, Dr. Mridula. Can you hear us? I think, Dr. Mridula, we are not able to hear you. Dr. Midula, can you just log out and log in once more? That would be better. So we move on to the next candidate. Dr. Rujuta, can you just call our next candidate?
So the next candidate is Dr. Sudakshana Mukherjee, and her topic of presentation is Dark Side of the Moon, the psychological intricacy a cancer patient going through due to pandemic, be it on the basis of emotional, financial, priority, etc. So
Dr.
we welcome
Sudakshana.
Dr. Sudakshana.
Are you able to hear us? Are you able to hear us? Dr. Sudakshana, are you here? Okay, can we go to the next participant, please?
Yes. So the next participant is Dr. Panti Patel. The topic of her presentation is Forensic Odontology, a budding branch in dentistry. So we welcome Dr. Panti.
Thank you.
Hi, Dr. Pankti. So I think we have all participants from all over India. That's fantastic. So, Dr. Priya, I would just like you to ask your question if you have any, and then maybe I will get into the picture. Dr. Priya?
Hello, Dr. Panti. Can you hear me?
Yes, ma'am. I can hear you perfectly.
Yeah, your presentation was crystal clear, very good. And
Thank
I
you.
would just like you to discuss what are the recent trends in forensic odontology. Not
Well,
just
talking. Yeah, ma'am.
yeah,
Sure.
I would like you to mention about the recent techniques developed, not the conventional ones.
Okay. So, speaking about the recent advances in forensic odontology, there are a lot. To be specific, I'll be highlighting a lot of research is oriented to digitalizing the techniques. So, the techniques which we were used to follow conventionally, they are now digitalized. So, like in age estimation or your sex determination, or basically any technique which was first conventionally done on your basic simple paper and pen is now converted into digital technology, because we are all, as we all are facing, the COVID pandemic. It is very difficult for even odontologists to be on site and assist in disasters on something. So the main trending topics I would like to mention is the autopsy. So basically what the autopsy means is like your virtual autopsy. So like as we are all conducting a webinar sitting here, we all can communicate. Similarly, teletherapy can be conducted. So if I'm conducting an autopsy in here in my room, you all can see, you all can guide, and the same thing can be presented in the court of law as well. So these are the trending things which are recently being highlighted in the field of forensic odontology.
Dr. Priya, any other question for Panti? Panti, what your name means? Can you tell me? That's
Oh,
very
my
interesting.
name actually means in Hindi it means Kavita ki Pankti. So it's like
Ah,
line of a poem.
so I have one question for you. Why did you choose to study forensic odontology?
Oh wow, that I get that often. So I'll just say that actually forensic odontology is a branch which is not much explored. Like in dentistry we have just I think we all just have one chapter which we read, that is in Schaeffer's. And that is by our pioneer Dr. Acharya. And when I went through this chapter in my UG days, I was very much inclined towards this field, and it is actually a budding field right now in India. So I was very much inclined, and in India we also have very limited courses actually, which provide this kind of extensive courses. I would say they are very limited extensive
Why
courses.
did
So
you choose it? My question was
yeah, so
why.
my main reason choosing this field is because first I was drawn towards it immediately after my UG. So I did not want to pursue masters. Frankly, I was more inclined towards research, and that too something which is very different. So that is what which that drive took me towards this field.
That's amazing. That's amazing to know. So you have presented on as a budding branch in dentistry. So can you just add on a few lines, maybe one or two options for people who are junior to you will be help. They'll get that information. So what do you think is a actual job prospect after studying forensic odontology in Indian perspective?
Speaking honestly, forensic odontologist does not only mean that you are supposed to do only field jobs. It also has a very large umbrella which is oriented towards research, and which is particularly what I am interested in doing. So, as you all know, that scientific methodologies need to be published. Otherwise, there's no implementation practically. So both things go hand in hand. So for me personally, I'm more interested towards research. But if someone is, interested corely in doing field jobs, then we have ample of opportunities. It is not restricted only to doing researches or only teaching field. There are also opportunities where you can actually do field work being an odontologist.
Okay, okay. I think that's pretty cool tips from you. Thank you so much. So I think we'll pull on Dr. Mridula Mohan. We lost our connection before. Yeah.
Hello. Hi. Good evening, ma'am.
Good evening.
I hope I'm audible now.
Yes, yes, you're audible.
Oh, thank you so much.
Okay, so Dr. Mridula, you have
Yes.
presented a very good, you gave a very good session on innovations in salivary biomarkers based in oral cancer.
Yes, ma'am.
So, as I understand, you are particularly pursuing your PhD in this particular area, maybe, if I'm not
Yes,
wrong.
ma'am. Yes,
Maybe
ma'am.
related
I'm
to,
pursuing my
yeah,
PhD. Yes.
yeah, yeah. So my question is, okay, your topic, your presentation is very pertinent to the present times. But do you think that really saliva can be a real good diagnostic basement for assessing or diagnosing a polygenic disease like oral cancer?
A very relevant question, ma'am. So saliva as a biofluid, we have, serum, we have test based on urine, but the biofluid that is easily available, that is saliva, that is the potential of saliva is not being explored. If you do further research, if you do proper research on the markers that is available on saliva, I think we can definitely come up with tests that are reliable and more specific and sensitive from saliva itself. The problem with salivary research is that we are not able to validate. There are not much studies that are there that has validated the particular markers. Not only markers, we have all the kind of metabolomics, the proteomics, the transcriptomics, the microbiomics of it. So we have not actually validated and done further research like what we have done with serum or like what we have done with other biofluids. So
I,
we are,
I don't agree at all with you. There has
yes,
been
I mean,
lot and lot has been done with saliva.
yes, ma'am. That is particularly for the just for the past decade, I think. For the past
No,
10 years only, we have.
saliva is
Okay.
30 years old thing. So my question was different. My question, I was not trying to understand what are the disadvantages of saliva. What I tried to ask you, let me maybe, I didn't put my question correctly. So for your better understanding, I ask you the question again. So my question was that you took this topic, that is very fine, but like as you are a researcher at this point, like you have chosen your career is going in that pathway. So you are a researcher now at this point. So as a researcher, as a you have a vision, right? You are doing something, so you have definitely have a vision out of this. So my question was, do you really think that a biofluid like saliva can be a base of diagnosis uh, for a disease, complex disease like
Complex.
oral cancer? What is your perspective to it? Okay, I just wanted to know that. Yeah.
Okay, ma'am. As saliva, as we know, it is complex. It has a lot of additional factors that is from this microbiomes and all. But if you ask me, to be very honest, what we're looking at is to have a screening test rather than, to diagnose an oral cancer. You don't actually, visual examination is more than enough, or a biopsy is more than enough. But what we need, what the lacunae here is, we really have to pinpoint a developing carcinoma in a pre-cancerous state. We really should be able to pick a cancer from the very beginning, from the very state of field cancerization, and from the very beginning of that molecular changes happen. So cancer, if you look at it, it is actually a process which is due to dysregulated signals. So if you I look at cancer in such a way that there are a lot being done in cancer, that you look into the cell, look into the nucleus, you look at the nuclear features, but that is not what we should be doing, is what I feel. Because in a way, I can give an example that you are stuck in a traffic. You're in a traffic, and the reason for your car is not moving is that because the signal is red, or there is a problem with the signal. But what we do is we think that there is something wrong with my car, and I look at my car, I open the hood and see what's wrong with the car, Actually, there is nothing wrong with the car. The problem is the signal system. So we should be looking at these molecular signatures or the molecules that are that are part of the signaling pathways instead of looking at the cell as such. So that's why I want to look at cancer. So that's how I want to look at cancer research as of now.
Okay. Okay. Thank you. So, Dr. Priya, do you have any question for Dr. Mridula? Dr. Priya, are you there with us? Yeah.
Hello. Hello, ma'am. Hello,
Yeah.
Dr. Mridula.
Hi, ma'am. Good
Am I
evening, ma'am.
audible? Good evening.
Yes, ma'am.
What will be the role? How will you discuss about the role of salivary microbiome in the diagnosis for oral cancer?
Oral cancer, actually, as of now, microbiome is not the part we are looking at. We are looking at the proteomic aspect of,
Proteome.
yes, ma'am. Proteome and metabolomics and transcriptome. That's the three omics that we are
Oh,
looking at for cancer. Yes, microbiome may be applied to a more systemic or infectious disease or systemic diseases, not for cancer.
not for cancer.
Yes, ma'am.
Actually, there is a lot of work going on salivary microbiome in oral cancer,
Actually,
pre-cancer and cancer.
pre-cancer, that is actually associated with the HPV related lesions. That is pretty not much common in our population.
Yeah, but HPV is just one virus. There
Just
are
one.
bacteria are more. When you say microbiome, it more goes in the favor of the bacterial population because they are the main inhabitants of the oral cavity, make up the majority of the microbiome. So a lot of work is being done, but still it is at a very primitive stage. So not
Yes,
into does not have translational value and so
translation.
on. Yeah. Good. This is a topic close to my heart also, salivary biomarkers and saliva research on saliva.
Okay. So,
Thank
Oh, yes.
thank you, Dr. Priya, for that nice question,
yeah.
and thank you, Dr. Mridula, for your insights. So, I think I'll just pull up Dr. Sudakshina if she's available. Dr. Sudakshina, are you available? I don't know what's the problem. Okay. So, we'll do it when Dr. Sudakshina is in a good network zone. Okay. So, we have Dr. Anvisha. Rijita, can you please just
Yes, ma'am. So next candidate, we have Dr. Anvisha Biswas. The topic of her presentation is saliva as a diagnostic aid for COVID-19. We welcome you, Dr. Anvisha.
Okay, hi, Dr. Anvisha. So I have one question for you. So why did you choose this topic? That is my very simple question. What made you choose this topic? Dr. Anvisha, can you please unmute and speak?
Sorry, ma'am. It because it is. Thank you for your question, ma'am. It is because it is one of the current emerging topic, and because as compared to the because for the collection of the saliva we take for the COVID-19 patient for the RT-PCR, but the I just chosen the topic for the saliva because for RT-PCR it has caused many discomfort for the patient like the gagging problem, but for the saliva collection with the COVID-19 it has many advantages because it is simple, it is easy to handle, it is easy to transport, and there is no need of a specialized healthcare workers devices. There is numerous samples can be obtained. It is economical and the less chances of a cross infections. So that is the way. That's why I've chosen this topic.
Very, very good pinpointed answer. So, Anvesha, can you tell me any test that you have come across, particularly salivary test I'm talking about?
There is a there's a different common kits used like there is a Thermofix, Applitex, and the Alipex and Cobas and SARS-CoV-2 and COVID RT-PCRs and the novel coronaviruses, real-time RT-PCRs. So these are the tests which is commonly used for this.
Thank you. Thank you. I think Dr. Anvisha's background research is fantastic. So, Dr. Priya, I would just request you to for your question. You can unmute. Yeah.
Yeah. Yes, Dr. Anvisha,
Yeah, ma'am.
am I audible? Good
Yeah, ma'am.
evening.
Good evening, ma'am.
Yeah, I would like to ask you just one question. What points would you consider for improving the standardization and validation of saliva as a diagnostic tool?
Ma'am, one of the most disadvantages is like, and it has a reduction in the sensitivity and it has a false negative results. So if we emphasize
Right.
most in the sensitivity, like which is 83.2%, so if we emphasize more on this, so it can be helped more in the collection of the COVID-19. So thank you.
Very nice. Thank you, Dr. Anvisha, for your insights, and thank you for participating and being here.
Thank you,
Okay.
ma'am. Thank you.
All right. So we have Dr. Prajna Shetty. Dr. Prajna Shetty, are
Yes.
you here with
So
us?
next,
Hello, ma'am.
Hi.
Can you hear me?
Yeah.
Hello.
Dr. Rujuta, can you just introduce our participant?
yes, yes, ma'am. So we have Dr. Prajna Shetty with us, and the topic for her presentation is hidden overdenture bar in a fixed implant retained hybrid prosthesis, a novel technique. We welcome you, Dr. Prajna.
Thank you, ma'am.
Okay, Dr. Prajna, my one question is I think what you have given the topic is hidden overdenture bar in a fixed implant retain hybrid prosthesis, a novel technique. Can you explain this
Yes, ma'am.
technique in 3 lines?
Ma'am, I think one of the contestant herself has given a topic, the dark side, affecting the psychological and financial thing. But I think we couldn't connect to her. I think it is aptly fitting to my thing, especially in developing countries. And when patients are having oncologic situations, and when we want to do a full mouth rehabilitation to them, if we go in a conventional manner, rehabilitation will become very expensive, and if any of these implant fails, like in the future, I will have to remake the entire prosthesis, even if I have to make a removable one. So I have come up with this technique where even if any of this implant fails, I can use the same framework and make it into a fixed removable type of prosthesis, so that it is very apt for our country that now, for example, if I place 3 implants and I gave a fixed one, and now one of the implant fails, now even if he has to go for a lower one that is a removable, but still he'll have to go in and I have to fabricate a new prosthesis. And we all know that implant and implant components is expensive, and already they will be having the burden of surgery, radiotherapy, chemotherapy, and one set of prosthesis. So if this kind of prosthesis is done, so the same framework I can just remove the overlying acrylic envelope and convert it into a fixed removable type of overdenture prosthesis. So it will be
Okay,
very helpful.
so your technique allows something like reusing the existing prosthesis. You can,
Yes, yes, ma'am.
and is it only
Yes.
for dedicated for cancer patients or people who are undergoing cancer therapy, or is it for even normal
No, no, not
patients? Anybody who
not
needs it.
necessary, ma'am. Anybody, ma'am. Anybody, ma'am.
Okay, that I thank you, Dr. Prajna. Dr. Priya, do you
Thank
have
you,
any
ma'am.
questions?
Hello.
Okay.
Hello,
Hello,
Dr.
ma'am.
Gargin.
Good evening,
No
ma'am.
questions from my side. Good evening, Dr. Prajna.
Good evening.
Okay, fine. So thank you, Dr. Prajna, for that. And
Okay.
I'll just try to pull up Dr. Sudakshina. Sudakshina, can you hear us now?
Yes, 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 ma'am. Good
Great. So
evening,
we'll
ma'am.
ask very fast because it's kind of very unstable network with you. So we will not keep you waiting. So Sudakshina, I saw your presentation and I just try to understand that your title is very catchy, Dark Side of the Moon. So what made you give this title to your session?
Actually, ma'am, now what situation we are all in, is actually the dark side, the situation we are in, the pandemic situation, chaotic situation, which is affecting the each and every part of human lives. no one can tell that I am better than you or I am worse than you. Everybody is equally affected. In this situation, we are more focusing on the COVID patients. What are the factors in the COVID? But we are not. What we are not getting is the immunocompromised patients, their psychological impact, how it is affecting them. See, as an oral pathology student, whenever I give up the carcinoma report, sir or madam, you are having this oral squamous cell carcinoma, well differentiated, moderately differentiated. It is very easy for us to write and give. But they are already in a stressed condition. I am having a carcinoma and my whole world is getting shattered because of this. Overall, this COVID is there. So how it is affecting? Since I am in this field, it is on my perspective. This thought came to my mind: how they are coping up with the situation. For a normal human being like us itself, this much we are hard it is for us to take. But for these people who are already in a stressful condition, how it is affecting? That time I searched some articles, literatures, and I found out that it's not like I'm only the person who is thinking. Many people are there who is undergoing researches regarding this, how it is affecting the carcinoma patients, how stress is under the main cause of metastasis. If we are thinking also that the patient is well differentiated, he can go under treatment and it can modify his life. Because of this COVID situation, we are actually aggravating it. So we are not less than COVID situation. We as an oral pathologist thinking that we will diagnose a case and give it to them and it will help them in some way. But somehow, because of us also, because of COVID situation also, it is actually degrading their life more. And surgery also, if we are performing, that is like a traumatic for them. That is also a stress related to them. So they are not at all happy or they are not at all whatever we are not thinking, whatever we want to intervene, whatever we want to investigate, which is the dark area of that moon. Bright side only we can see, okay, this is the situation, this is the COVID pandemic situation, this is the problem. But under that, what is there? Under that, what more we are facing? That is only my. I tried to portray in 8 minutes, but I don't know how I made it done.
Okay, that's amazing. Okay, Dr. Priya, do you have any questions for Dr. Sudakshina?
Dr. Sudakshina, good evening. You spoke very well
Yes, ma'am.
and very
Good
nice,
evening, ma'am.
very good, very good. No questions
Thank
now.
you, ma'am.
Okay, so I think we have our I think we have Dr. Baiva with us, but I don't see Dr. Baiva. All right. Okay. Yeah.
Good evening, ma'am.
Good evening, Dr. Baiva. Just a minute. All right. So I think I will ask Dr. Priya to put forward her question to Dr. Baiva first, and then I think I'll take it up.
Hello, am I audible?
Yes, ma'am.
Your Dr. Vaibhav, your topic was about the scope of oral medicine and radiology. You gave
Yes,
a
ma'am.
very good presentation. I would like to ask you one question, what changes or what things you feel should be incorporated in the syllabus or the training which is given during the course of oral medicine and radiology, which is not currently there in the syllabus, which you feel should be incorporated.
Ma'am, I think that as far as diagnosis is considered, many recent diagnostic aids they can teach in oral medicine. Like for example, we have something called as therapeutic ultrasound, but there is something also called as diagnostic ultrasound for oral submucous fibrosis. So such
Right.
topics should be incorporated in oral medicine. And apart from that, as regards to advanced imaging techniques like CT and MRI, the PGs of oral medicine should be posted more in these peripheral areas for more duration so that
Right.
they come to know more about these modalities.
Right. Right. That's a very good answer. So more hands-on should be there regarding the how to use the advanced diagnostic techniques, which are more of read in books and not practice hands-on. That's what you want to say, right?
Yes, ma'am. Yes, ma'am.
Yeah. Good.
Thank you.
Thank you.
Thank you, Dr. Priya, for that question. And thank you, Baiva, for being here and participating in this
Thank you.
webinar and making all efforts. So I have one question for you. Can you give me 5 points why one person should pursue MDS in oral medicine and radiology? 5 points.
First of all, I think it's a backbone of dentistry.
Okay.
Second, a person learns a lot regarding diagnosis. Third, regarding formulating treatment plan, I think oral medicine is the best branch for it. And fourth, it sits at an interface between dentistry and medicine. So you get an edge to know more about how to manage medically compromised patients. And fifth, you can be a part of a research in many fields, because I think it's a best branch to pursue research. So I think these are some of the points why anyone should pursue oral medicine and radiology.
Okay, that's amazing, fantastic. And thank you everybody for being here today. And I think we have come to the concluding part. I hope I haven't missed up anybody, any participant. Okay, so yeah, so we will just evaluate and we will come up with the results we'll shortly announce it. So to commence the closure, I think I'll just ask Dr. Rujuta to help us. Okay, and I'll try to pull up few of you on screen. I don't know because we are not able to pull up everybody on screen. So I'll just try that. Yeah, Dr. Rujuta, you can just do your part. I'll just play with here around.
Yes, ma'am. So I thank all the participants for your enthusiastic participation in this international webinar competition. It was great to hear you all, and everybody did very well. And the winner for this competition will be announced soon. So keep an eye on our Facebook page of Indian Academy for Clinical and Dental Genetics. So we'll be posting the winner there. So I think with this, I would like to thank our chief guest and the jury member for today, Dr. Priya ma'am, for being with us and sparing her valuable time for this competition and being the jury.
Thank you.
And I thank all the participants also.
Thank you. Thank you,
ma'am.
Dr.
And I also thank. Okay, so I also thank all the participants who have again participated here. And with this, I would like to add a note that as I already mentioned, that this international webinar competition was organized with an idea to encourage the budding students and also the early career researchers so that they can show their talent of presentation as well. So with this aim, we have also come up with a blog writing opportunity so they can show up their blog writing talent, their writing skills as well for the SALSI 2022 upcoming SALSI 2022 event. The registered participants will get an opportunity to write a blog. We have created a separate section known as SALSI or Saliva blog in our website. You can have a look at it, register, and take this opportunity to express your writing skills in the form of a blog for this international event. So I think.
Okay, thank you so much for being here, and it was amazing to see all of you. But I'm sorry that I cannot pull up all people together here, so I just kept flipping around, and we'll shortly come up with the results. And just as Rujita said, you can just have a keep an eye on. Can you please keep yourself on mute? Yeah. So just that you can keep an eye on the page, and we'll be flashing it. And just to make things more interesting, and I really think this is a competition which we made just to encourage science. Okay, each one of you have your contributions are amazing. The efforts that you made, I really want all these to come up as webinars. So because I have all the recordings, maybe for few of them we need more refreshed version. So we will be contacting you. Even if you are not a winner, don't worry. Okay, so all the webinars are safe with us, and we actually want to showcase them through our channel to everybody, because a whole lot of fantastic information has been shared through your presentations. So this is just a competition and just to keep you motivated and encouraged. And thank you for the energy that you have shown. I think we have been working on this for the last 1 month or maybe a little more. Okay, so thank you so much, and we'll keep meeting again, and all the best to all of you. Thank you. Bye bye. Take care, and all the best. Bye. Bye.